Greetings to everyone. So, welcome you all to another episode of Dr. Robert's chapters. So, today's chapter is basically a very useful one. Okay, so as a physician, like today, when I've completed my MD and when I sit in my clinic, often my ears, my all my senses has to be very active when I hear a patient symptom. Okay, so when I get a symptom, imagine I get a symptom. Okay, this symptom, like for a layman, it's just a symptom, okay? You are not a doctor, or even if you're a doctor, if you belong to other school of medicine, a symptom is a symptom. Based on that, you give a remedy, okay? But in homeopathy, for a homeopathic doctor, you need to classify the symptom in two ways, okay? The two way can be either common, characteristic, or whether it is subjective symptom, or can be felt by the patient, that is through the senses, or objective symptom, or you're going to classify it by general symptom or particular symptom. General is based in the entire body, particular is based on any organ, or a keynote symptom, or the list goes and on. It goes whether it's a pathological symptom or pathological general symptom. Um, there is many characteristic common. There's the classification will go on. Okay, but this chapter specifically, we are going to deal with the topic like whether it is a chief symptom or an auxiliary symptom. Okay, so there are only two types of symptom that we are going to see in this chapter. So the chapter's name, chapter number 11, chief symptom, which will be compared with auxiliary symptom. Before we start what Roberts has said in this chapter, I will just say a brief about it. When a patient comes with a symptom, we are going to classify it in this chapter in two ways, okay? Whether it's a chief symptom or auxiliary symptom. Hearing the word chief, it might sound like it should be a characteristic symptom. No, okay? Chief symptom is any symptom that the patient starts seeing. Like when a patient comes to you, he says, I have a headache, I have a toothache, I have a ear pain, I have a earache. He might say anything. So whatever the patient says in the beginning. So the first thing, how do you know what symptom is a chief symptom? The symptoms which the patient reports. Okay. How do you know it's an auxiliary symptom? The symptoms that the patient may not notice. Okay. You get on further inquiry. Okay. Now, is there any use of chief symptom? If it is what the patient says, like if a patient says, I have headache, toothache, no, and you say it's a common general symptom. So, is it important in homeopathy? Yes, it is important. Why? Because that is the symptom which brought the patient to you. Okay. A symptom, it's an entry point. It's an entry point in the case. Okay, through which you will discover the characteristic, whether this headache is characteristic or not. So it is an entry point in the case. And how is auxiliary symptom important? This symptom will help you to create a totality. It will help you to get the unique aspect of the case. Okay. So use the help you to find the totality, the complete picture of the case. Okay. Now the third point. Now, is it like I'm a doctor now? Okay. How does a doctor become how do you know this doctor is a skilled doctor? Okay. If he's a young doctor, he would get this symptom, chief symptom, very easily. Okay. He will only focus on this. He would focus on chief symptom. Like he would say, Acha, you have headache. So, okay, we will, no, doctor, he has a headache. So, we will give him Natramil. He has a headache. By sun, we will give him Glonol. If he has a psoriasis, which is on his palms with dry cracks, we will give him graphitis. So, these are the young doctors who will focus only on the chief symptom. So, who will focus on auxiliary symptom? The experienced doctor will go beyond the chief symptom. Okay, here we go. Now, young doctor, experienced doctor. So, okay, young doctor, experienced doctor. First, what did he see? What is a chief complaint? The patient reports. What is an auxiliary symptom? The patient may not notice. Now, is how do you get a chief complaint? What is the use of it? It's the entry point. What is the use of auxiliary? It gives a totality. Young doctor focuses on chief symptom. Auxiliary symptom. Experienced doctor focuses and goes beyond. Okay, you will start exploring it. Now, the fourth one, the most important one. Okay, we saw use of both, but still, the use of chief symptom is very minimal. Okay, so it's not always important. Is auxiliary symptom important? Yes, it's very essential. It's essential for understanding the case. Okay. Till now, what we have understood, a chief symptom is the one which patient reports. It gives an entry point. A young doctor will focus on it, and it's not always important. Auxiliary symptom, it's the one which an experienced doctor will go for it. It's the one which the patient may not notice. It will help to find the totality. It's a unique aspect of the case, and it is essential for understanding the case in detail. Okay. Now, pathologically, how we will see a chief symptom, and pathologically, how we are going to see an auxiliary symptom. Okay. Pathological point of view, how we are going to see pathologically. Okay, how does a modern science or any other doctor going to view this chief symptom? Okay, what he will find in a chief symptom, it will be related to an organ or a tissue. Okay, or it would be a functional symptom. What he will pathologically, how will an auxiliary symptom look like? It will seem meaningless. Like, for example, a headache, which is simulated in open air, won't be, pathologically significant for a doctor from other school of medicine. Okay. He would say it's an accidental thing. So, okay, accidental finding. Now, Dr. Robert has given an example. Okay. So the next thing, the fifth point is an example which Dr. Robert has given. Complete look like, doctor, I have a ovarian pain. Okay. This is how a chief symptom will look like. Okay. How will an auxiliary symptom look like? This is the chief symptom for the ones who are seeing the video from here. Auxiliary symptom. Example. How will an auxiliary symptom look? Doctor, I have a pain in ovary. Okay. But the pain is sharp. The pain is sharp pain. Uh, and which is specifically after meals. Like after I finish my meals, I'm getting this sharp pain. Okay. And also, along with this, I feel very thirsty at night time. Now, and also she's saying I'm feeling very sensitive to cold air since the time I started getting this ovarian pain. So is it from the beginning, we are going to apply this one to all the points we have covered. Okay. So what we are, ovarian pain? Yes, the symptom that a patient report is an ovarian pain. It's the entry point. Ovarian pain, doctor, I have a pain over here. It's the entry point. Yes. Young doctors mostly focus over this. They don't ask further. Complete. Is it always important? Only pain in ovary is always important? No. It's not always important. Ovarian pain would determine hint, which ovarian pain will give a hint that they have some issue related to organ or a tissue. Now, on the other hand, when a patient says, I have sharp pain after meals, it would seem very meaningless pathologically. Okay. Sometimes for a homeopathic doctor, you got the symptom after inquiry. An experienced doctor will go beyond the ovarian pain and ask about the sensation, will ask whether any change in your appetite, change in your taste, change in your thirst. Are you feeling extreme sensitive to cold or heat? So on further inquiry, I hope you got this example right. Okay. Now, what are the limitations or advantages of a chief symptom and an auxiliary symptom? That's what we are going to see. Okay. So now, an advantage or a limitation. Okay. So we are going to see limitation of chief symptom. This ovarian pain will at least have 50 remedies in repertoire. Okay. This ovarian pain will have 50 remedy in the repertoire. Okay. So this only on basis of this, if a young doctor starts giving on 50 remedy, which remedy will he give? Which one remedy? So this will create a lot of confusion. That is the first limitation of chief symptom. Okay. On the other hand, is there any limitations of auxiliary symptom? No. Now, we are going to see advantages of both. Advantages. Chief symptom and auxiliary symptom. What are the advantages? On chief symptom, there is no advantages here. Okay. There's no advantage in chief symptom. For auxiliary symptom, the advantages is out of the 50 remedy that we saw from chief symptom, it narrows down. When a patient says, I have a sharp pain after meals, it will narrow down the ovarian pain ka modality ki wajah se. Because of the modality of the ovarian pain, it will narrow down the number of remedies, right? And when you apply the thirst, when you apply sensitive to cold air, it will further narrow down the remedy. So it will help to find the right remedy. Okay. Now, Dr. Robert has compared this chief symptom and the auxiliary symptom to like a metaphorical way. Okay. So everyone knows a fabric, right? For example, there's a fabric here. This is a basic pattern. Okay. Assume this to be a warp for fabric. The basic threading which is done, like the entire fabric. Okay. This is the stitching which is done with the threads. So this is the base of the fabric. Okay. This is called, this is the warp of fabric. Okay. And now above this, if I add some kind of design here, the threadings. Okay. So this is called as weft threads. So chief symptom, Dr. Robert has compared with the warp of a fabric, and auxiliary symptom he has compared with the weft threads. Okay. So both determines the case. A patient starts with the ovarian symptom. That's the base, okay, on which our experienced doctor will further start seeing what is more characteristic. So what is the advantage that we saw? Chief symptom created confusion. Auxiliary symptom narrowed down the remedy. Okay. Now, what is auxiliary symptom? We didn't define it properly, right? We just said of symptoms that the patient may not notice. So that's not a right way to define an auxiliary symptom. Okay. We just started the chapter with that way. But right further, Dr. Roberts defines what is auxiliary symptom. So he says auxiliary symptom is unrelated to the chief complaint. Okay. But occurs simultaneously. Now, second point he says it's often ignored by pathologists. So by other school of medicine, they are not considered. Further, he says there's an immense value in homeopathy. Okay, so all the practicing young doctors seeing this video, axillary symptom and chief symptom. It's basically like a common symptom, characteristic symptom, general, but common, general, common, particular, whatever. But right now, in this chapter, Dr. Robert defines and classifies symptom as two ways. One is chief symptom, one is auxiliary symptom. Okay. So he says the auxiliary symptom has immense value in homeopathy. Now, he has given an example of two cases, which we are going to see now. Okay. Case one, tension, stiffness in back. Patient says he has tension, stiffness in back muscle. Okay. Now, along with this, a patient says, whenever I get this tension and stiffness in back muscle, I also get leukorrhea only when sitting. This symptom will have at least 50 to 60 remedies. Okay. But when you add this chief complaint with this, so this lands up in one remedy, that is fagopirin. Okay. Now we are going to see a case example too, which Dr. Robert has mentioned in this chapter. The example that he gives is of chronic asthma, okay, with wheezing, which is a common symptom, and suffocation. Okay. Along with this, okay, a patient gets this symptom, which is aggravated by anger, which is aggravated on eating, and he gets choking sensation, okay, in stomach. So when this symptoms, chronic asthma, wheezing, suffocation, gets aggravated by anger and aggravated by eating, along with that, if the patient complains of a choking sensation, the remedy that gets pointed out is Mancinella. So that sums up to this chapter. I hope you understood this chapter in detail. I tried to simplify it as much as possible so that the students who are preparing for their PGs or the students who are going to give their exams in third and fourth year, I hope this chapter was useful. For like from my perspective, like whenever I see this chapter, I always feel it reminds me that all the patient that coming to my clinic, I should not land up only with the general symptom or the chief symptom. I should go further. If I have to be experienced, I should go further in searching for symptoms which gives immense value. Okay. Once I add value to every symptom, once I make it to an auxiliary symptom, I'm definitely not going to do, no, the case is going to get solved for sure. The aim is to reach an auxiliary symptom. The more you reach, the more you're going to crack a case. Okay. I hope this was useful. More videos will be coming soon. And yeah, stay tuned.